Have you ever felt like your emotions take you from the highest highs to the lowest lows, with no warning? One moment you're full of energy and confidence, and the next, you're overwhelmed by sadness, fatigue, or hopelessness. This isn't just a mood swing, it could be bipolar disorder. Often misunderstood and misdiagnosed, bipolar disorder is a serious mental health condition that affects how a person experiences mood, energy, and activity levels. In this video, we'll explore what bipolar disorder really is, the different types, its symptoms, causes, and how it can be treated. Let's break the stigma and understand the science behind the swings.
Imagine living in a world where your emotions are amplified. Simple situations feel overwhelming. Relationships feel like a matter of life and death. This is the reality for individuals with borderline personality disorder, or BPD. BPD is a mental health condition characterized by intense emotional experiences, unstable relationships, and a fragile sense of self. This essay will explore the complexities of BPD, shedding light on its causes, symptoms, and most importantly, the path to recovery. BPD falls under the category of Cluster B personality disorders. These disorders are characterized by dramatic, emotional, or erratic thinking and behavior patterns. While everyone experiences emotional ups and downs, individuals with BPD experience these emotions with a heightened intensity that can be difficult to manage. This often leads to impulsive actions and difficulty maintaining stable relationships. The Diagnostic and Statistical Manual of Mental Disorders 5th edition outlines 9 specific criteria for diagnosing BPD. To receive a diagnosis, an individual must meet at least 5 of these criteria. These criteria include fear of abandonment, an intense fear of real or imagined abandonment, often leading to desperate attempts to avoid being alone. Unstable relationships, a pattern of intense and unstable relationships, often swinging between idealization and devaluation of others. Unstable self-image, a distorted and unstable sense of self, leading to frequent changes in values, goals, and aspirations. Impulsivity, engaging in risky and impulsive behaviors such as substance abuse, reckless driving, or binge eating. Self-harming behaviors, recurrent suicidal threats or actions, or engaging in self-harming behaviors such as cutting or burning. Emotional instability, extreme mood swings and emotional reactivity, with emotions shifting rapidly and intensely. Chronic feelings of emptiness, a persistent feeling of emptiness or boredom, often leading to a search for fulfillment. Difficulty controlling anger, inappropriate and intense anger, often expressed through outbursts or difficulty controlling temper. Stress-related paranoia, experiencing paranoid thoughts or dissociative symptoms, especially during times of stress. The development of BPD is complex and not fully understood. However, research suggests that it is likely caused by a combination of genetic predisposition and environmental factors. Genetic studies have shown that BPD tends to run in families, suggesting a genetic component. Brain structure research has identified differences in brain structure and function in individuals with BPD, particularly in areas related to emotional regulation and impulsivity. Environmental factors. Traumatic experiences in childhood such as abuse, neglect, or witnessing violence are strongly linked to the development of BPD. Invalidating environments where emotions are dismissed or punished can also contribute to the development of BPD. BPD's impact on life. BPD can have a profound impact on various aspects of an individual's life. Relationships. The intense fear of abandonment and instability in relationships often lead to conflict, breakups, and difficulty maintaining healthy connections. Career emotional instability and impulsivity can make it challenging to hold down a job, leading to frequent job changes or unemployment. Self-image. The unstable sense of self and fear of rejection can result in low self-esteem, self-criticism, and difficulty forming a positive self-image. Mental health. Individuals with BPD are at a higher risk for other mental health conditions, such as depression, anxiety, and substance abuse. The BPD mind, psychological dynamics. Several psychological theories offer insights into the inner workings of BPD. Attachment theory. This theory suggests that early childhood experiences with caregivers shape our attachment styles. Individuals with BPD often develop insecure attachment styles, characterized by anxiety and fear of abandonment. Object relations theory. This theory focuses on how our early relationships with caregivers influence our sense of self and our relationships with others. Individuals with BPD may have difficulty developing a stable sense of self and struggle with object constancy, the ability to maintain positive feelings for someone even when they are absent or disappointing. Mentalization deficit. Individuals with BPD often struggle with mentalization, the ability to understand their own mental states and the mental states of others. This can lead to misinterpretations of social cues and difficulty empathizing with others, emotional dysregulation. A hallmark of BPD is emotional dysregulation, the inability to manage and regulate emotions effectively. This can manifest as intense emotional reactivity, difficulty calming down, and engaging in impulsive behaviors to cope with overwhelming emotions. Navigating the path to recovery, treatments, and therapies. While BPD can be challenging, it is important to remember that it is treatable. With the right support and therapeutic interventions, individuals with BPD can lead fulfilling and meaningful lives. Dialectical behavior therapy, or DBT. DBT is a type of therapy specifically designed for BPD. It focuses on teaching skills to manage emotions, tolerate distress, improve relationships, and increase mindfulness. Cognitive behavioral therapy, or CBT, helps individuals identify and change negative thought patterns and behaviors that contribute to their emotional distress. Mentalization-based therapy, or MBT, focuses on improving mentalization skills, helping individuals better understand their own emotions and the emotions of others. Schema therapy. This therapy addresses early maladaptive schemas, or core beliefs about oneself and the world, that contribute to BPD symptoms. Medication. While there is no specific medication for BPD, medications such as antidepressants or mood stabilizers can be helpful in managing co-occurring conditions like depression, anxiety, or impulsivity. Supportive environment. Creating a supportive and validating environment is crucial for recovery. This includes surrounding oneself with understanding individuals, practicing self-care, and engaging in activities that promote well-being. Conclusion: hope and healing. BPD is treatable. It is important to remember that BPD is not a life sentence. It is not about being manipulative or attention-seeking. It is about experiencing intense emotional pain and struggling to cope with overwhelming emotions. With appropriate treatment, support, and self-compassion, individuals with BPD can learn to manage their symptoms, build healthy relationships, and live fulfilling lives. Recovery is possible, and there is hope for healing.
And if you found this video interesting, don't forget to like, subscribe, and hit the notification bell for more mind-blowing psychology videos.